One form of the disease, breast cancer, is the most common cause of cancer-related deaths among women. We have reports now from two contributors on how patients around the world are fighting for their lives.
Bev Immerman's breast cancer was detected on a routine mammogram. She chose to have a lumpectomy. Her other breast is cancer-free.
The other breast was okay, and they didn't recommend anything be done with that side.
Still, 1 in 10 breast cancer patients will eventually get cancer in the other breast. And a new study suggests there may be a better way to find those second tumors earlier. Doctors took almost 1,000 women with a recent diagnosis of breast cancer in one breast, but not the other. Within 2 months, the women were given an MRI. The MRIs picked up 30 tumors that the mammograms had missed. That's about 3%. Dr. Patrina Causer was the only Canadian investigator in the study. She shows us an example of a breast cancer that was missed on a mammogram, but detected with MRI.
Couldn't see anything on the mammogram, it was normal, and actually went on to do a breast ultrasound to see if we could see it for purpose of biopsy, and could not identify it on the ultrasound.
But there are drawbacks to MRIs. For one thing, they're at least 10 times more expensive than a mammogram, and they are so sensitive, they reveal all sorts of suspicious growths that aren't cancer. Meanwhile, women need to have repeat scans and biopsies to know for sure. That, say experts, is why MRIs will never be routinely recommended as a screening tool to find breast cancer in healthy women.
I mean, we'll have to shut down the whole healthcare system and do nothing but biopsy, MRI found things that'll turn out to be nothing if we do that.
Still, evidence is mounting that at least in some women, MRIs should be used in conjunction with mammography. New guidelines in the U.S. recommend that all women at high risk for breast cancer, such as those who carry genetic mutations, be given regular MRI screening. And experts say that's the goal here in Canada, too, but access to the MRI machines and the technicians and radiologists needed to do them is spotty.
There aren't enough scanners, there isn't enough personnel, and there's no one willing to fund the extra costs, which are huge.
And that's why, for now, women like Bev Immerman will be closely monitored for any signs of a recurrence of breast cancer with regular mammograms rather than MRIs. Maureen Taylor, CBC News, Toronto.